continue on the topic of stroke, doctor, I would like to ask you, all strokes are same, or is there a difference between their severity levels?
So stroke, it depends on the area of the brain which it affects. So if it is affecting the cerebellum, then the main thing that the patient presents is ataxia, or the imbalance or the incoordination. They want to reach out to an object but they are not able to reach out. And if the area affected is pontine, so they may have weakness along with some dystonia, like they want to do it, hold it in a particular way, but their hands are going in a different way. If say a dominant part of the brain is affected, say when we say dominant, right side takes care of the left side of the body, left half of the brain takes care of the right side of the body. So for most of the people, 80 to 90%, the left brain is dominant. So when it affects the dominant side, then there is not only weakness, there can also be speech and swallowing areas which are affected. When it is the non-dominant side, right side, which is affected, then it can affect multiple aspects. It can just be a sensory stroke wherein only the sensation is lost, but power wise or the strength wise they are good, or they can be completely neglecting on their left side of the body, because the right side of the brain takes care of the spatial orientation of a person. So when that gets affected, they will not recognize left half of the clock. They will leave left half of the plate when they are eating. So all these actually requires different interventions, and that is what we guide in an institute based rehab based on the patient's clinical condition. Now that you mentioned about the virtual reality, which sounds very hi-fi, so how do you think that can help in all these different set of patients?
Okay. Yeah, so we do virtual reality at our center, and virtual reality is basically a computer driven interface wherein the person, it's more of a play form, it's more of game oriented, so it is self motivating. The patient looks forward for the treatment, and the computer is going to guide you for the movements. For instance, if there is a reach out activity, so the computer will show some balloon over on the right side and will ask the person to burst it. Only if it bursts, the next movement will come up on the screen. So he has to reach out on the right. So as you said, doctor, that a person can have a hemi neglect. He is not able to understand the right side. So we will try to train him on that side with the VR concept. Or if we want to train balance, reach out, as you mentioned, cerebellar is affected, so it will lead to ataxia in the individual. So we can train him on balance. There is different balance activities in the VR program. And as you also mentioned about speech, so if the language is affected, he is unable to articulate word, he is unable to understand words, cognition is affected, understanding. We also have cognitive programs in the VR system, wherein we can train the person on higher intellectual activities as well, and make him more functionally independent in the society.
Okay, to add to that, higher intellectual activities, you mean as simple as calculation also can get affected?
Yes. Calculation can also be trained with VR.
And
multitasking activities as well.
Okay.
So, and the person looks forward for it, and he is self-motivated for VR.
So that he can score where he is, he can see his improvement?
Yes, absolutely. And that self-motivates the individual because he can see his progression. We can map, there is a charting which is available in the software itself, how much you did today, and you can see your progress on the next day. Suppose you could reach out till here, next day your level has reached, your balance has improved. So it's a charted program wherein we can see the progress continuously, and the family also understands that my relative is improving with the virtual reality concept.
Good, that is nice to know.
To add to it, doctor, I would also like to ask you on the level of severity itself, is there something on HBOT that you would highlight on, because you are trained into hyperbaric oxygen therapy?
Yes, definitely. So hyperbaric oxygen therapy, actually it was initially managed for the area which is lacking blood supply or the oxygen.
Okay.
So stroke is such a condition where it happens because of sudden lack of blood supply to the brain cells, and brain cells are very sensitive to the oxygen and the blood supply. So even few seconds of lack of supply would damage the cells. So hyperbaric oxygen actually helps to improve the oxygen supply to those areas and improve the vascularity of those areas, and helps in cells which have been damaged also to recover to a great extent when it is started in the early phase of the stroke. Early phase, I mean within 6 months of the stroke. So the sessions go up to say 30 days or 40 days depending on each patient's condition. But we have seen that patient who was completely aphasic, not talking at all. So after this treatment, after a period of time, so the patient has started speaking.
Okay.
So there is a very good recovery that we see when rehab as well as hyperbaric oxygen is combined in stroke patients.
But doctor, I would like to ask you, by oxygen, what do you mean? Because all of us are breathing. So oxygen is continuously going in the body. What difference would an HBOT setup do to the individual?
So oxygen, when you are measuring the saturation, all patients,
Yeah,
yes,
99%,
99%.
yes.
So when I say we are giving hyperbaric oxygen, they will say that okay, he's already maintaining
Yes.
saturation. Why does he need?
Need more
So
oxygen.
the name itself says the oxygen is going in high pressure, hyperbaric.
Okay.
So when it goes in high pressure, it dissolves more in the blood. Normally oxygen which is there is 21% in the normal air. So in this machine the oxygen which goes is 99% to 100% pure oxygen which is going in. So the dissolution what happens normally, this is 20 to 30% more. So where there is vascular cutoff, so this dissolution in the plasma or the blood, it reaches to those areas through diffusion, and it helps in the recovery of the healing
So
of the
you
tissues.
mean that it's pushed into these cells and that's how
Yes.
they rejuvenate?
Yes.
Okay. So that will help the patient to recover faster.
Yes.
And also enhance the neuroplasticity?
Yes, so all these are done basically to help the cells to rewire or regrow.
Okay.
So that means it is all part of neuroplasticity.
That's nice. That's really good to understand. Fine. Thank you, doctor. Thank you.